Thank you. Today is December 4th, Thursday, December 4th, a little bit, let me get the time, at 3:07 p.m. This is the Cuyahoga County's Women's Health Commission, and I call this meeting to order. Will the clerk please call the roll?
Dr. Lauren Bean is not here. Heather Brissett. County Councilwoman Yvonne Conwell. Present. Emily Campbell. Dr. Melanie Golembiewski. She's on.
Here.
Oh, perfect. Great. Councilwoman Tennille Kouse.
Here.
Jasmine Long. Here. David Merriman.
Present.
Dr. Connie Moreland. I know LaShawn Carson is on for Dr. Moreland. Great.
Thank you.
Thank you. Councilwoman Nikisha Nickerson. Here. Great. Sabrina Roberts on behalf of the executive.
Here.
Councilwoman Jasmine Santana and Mayor Thomas are not with us today.
Thank you. Before we begin, I would like to call for a moment of silence and reflection, just to center ourselves around the important work and in recognition and contributions and challenges faced by women across the world. Thank you. The next item on our agenda is the approval of the prior meeting minutes. These meeting minutes were circulated to the commission prior to today's meeting. I now invite members to express their opinions or make motions related to this topic. Any corrections or additions from our members?
Motion to approve the minutes as presented?
Thank you.
Second.
Second.
Heather Brissette.
25th. I'll say that.
Yeah. We have a second from Councilwoman Conwell. All in favor, say aye.
Aye.
Any opposed, say nay. Let the record reflect that this motion has passed. Clerk, is there anyone that has submitted public comment for this meeting today?
None was received. I would like to just note that Heather Brissette has joined us virtually.
Thank you. We now open the meeting for new business. I'd like to start by inviting our Cleveland Foundation Fellow, Agatha Hickerson, to take the floor to talk about the success of November's Period Product Drive. Thank you so much for being here this afternoon.
Yeah, hello everyone. Thanks for having me and thank you all for being here.
Can you pause for one moment? I have
Yeah.
to just pull up your having a
Absolutely.
tech difficulty.
Is everyone okay on Teams? Okay, perfect. So as we discussed at the last Physical Health Committee meeting, we here at the county coordinated a period product donation drive where products were collected for PADS Inc., that's Pride Among Daughters and Sisters. They have a storefront over in Cleveland Heights. So the drive ran from November 3rd through 25th of 2025, so it ended right before Thanksgiving. And we had donation drop-off locations at county headquarters, the Justice Center, the Jane Edna Hunter Building, and Virgil E. Brown. And Jane Edna Hunter actually donated the most products. They were able to collect over 7,500 individual products, which is absolutely amazing. So in total, we had over 16,000 products collected. And I heard back from PADS Inc. that we also had over $1,000 in monetary donations as well. So I would say that this drive was very, very successful. One county employee that was one of our volunteers emailed me, "This has been a wonderful success. We haven't done a donation of this kind before. I hope we can organize this again." And that was a common sentiment among a lot of people. And then one of the PADS employees said, "We are so forever grateful for the awesome turnout and commitment from the Women's Health Commission and all the county employees. Your donations were well above any expectations we had." And I actually just yesterday went to go pick up a couple extra donations from the Virgil Brown building. So we'll get those added to our final total as well. And then if we go to the next couple of slides, we have some pictures. You might see some familiar faces, mainly Councilwoman Conwell is there, and then myself and Audrey. And then on the next slide, we have some photos of David Merriman, Women's Health Commission member, helping with pickup at Jane Edna and Virgil Brown. And then in the photo to the right is myself, Audrey, Laurel Diaz, and then Julia Garber, who works at the Justice Center and was one of our volunteers as well. So yeah, it was very successful. Thank you all.
Thank you, Agatha. I want to also say a shout out to Leadership Cleveland, class of 26. They also have donations. Emily Campbell was unable to be here today, but we saw each other this week and she will coordinate to drop off from that class.
Oh, fantastic. Yeah, I didn't know about that. Yeah. Does anyone have any other questions or additional comments?
I just want to acknowledge that in that middle photo, it's, the upper level is myself with Rachel Benders. And one employee or an organization, we don't know who, purchased 13 boxes. In each box, there were 250 tampons. So that's just from one donation. And so there was just a real significant commitment from the the Jane and Hunter team. And I think everybody was shocked at the volume.
Absolutely. Thank you so much, Agnetha, and thank you to everyone who supported this important initiative. We're thrilled to hear that it went so well, and hopefully it's something we can incorporate annually. And even I would say this: if this was the pilot, then we can only go up from here and get more organizations involved. So that was wonderful. So thank you for all your work, and thank you to all the county employees and everybody who donated. So appreciative. Our next item of business will be updates from our two committees, the mental health and physical health. Both groups met in October to do further planning on initiatives that they would like to undertake in 2026. I now invite representatives from each of those committees to share reports of the initiatives that were discussed with the full commission today. We'll begin with Jasmine Long as a representative of the Mental Health Committee.
Thank you. And I'm kind of going to tag team this with the councilwoman. She doesn't know it yet, but just because she hosted the event, and if she wants to say anything about it, I want her to be able to speak to it. But we did have a very successful event in partnership with the Office of Violence Prevention. We had a successful domestic violence event. This was in October to help empower women throughout our community. And we know that we want to continue to focus on this and have this be a topic also in October of 2026. I saw a report that showed domestic violence is up, it was either 38 or 36% this year. And so we know that it's an important topic for us to continue talking about and focusing on and helping to educate people. And so Councilman Conwell has talked about doing each week having a different topic in a location, done with partners throughout our entire community, and given ourselves a year to plan. We can really put a calendar together to do some really successful events. We want to start planning in the new year by committee and get the series on the calendar now so that people are aware that this is coming. Anything else?
I would just like to add, I guess we're in sync. I have a meeting early part of January with the new CEO at I want to say Domestic Violence and Child Advocacy Center, but I know they changed their name to Journeys. And so I will be meeting with the CEO and FACE to get the initial meeting of what I do and what I've done in the past with the previous two administrators, and to see if she's willing to come on board. So, thank you.
And as we talked about in the last meeting, we're really excited to look at what a podcast could look like for the both mental and physical health. And so in our January meeting, we're going to start to bring our ideas together so that we can talk about what that could look like, who's going to produce it and all that stuff, and how we're going to get that out. So that's going to happen then. In the meantime, committee members are supposed to be researching topics so that we come to that meeting prepared and ready to kind of put a calendar together. And then finally, we discussed the idea of an event series with the Physical Health Committee as well. And so really thinking about how we can do some things in partnership over the next year in order to focus on both mental health and physical health as a forum, because so many of these topics are linked together anyway. Thank you.
Absolutely. Thank you so much, Jasmine, for that report out. I now open the floor for discussion of initiatives shared by the Mental Health Committee, specifically shared by Jasmine and Councilwoman Conwell. Any comments, questions, or thoughts? Wonderful. We will move right on to physical health. And we, of course, look forward to any future developments with the Mental Health Committee and looking forward to that continued partnership with the Physical Health and Mental Health Committee. I now want to invite Dr. Melanie Gombowski to share an update on the Physical Health Committee.
Everybody. At our meeting, we talked a lot about ideas for particular events and topics, especially thinking about the locations that we could have them, places that we had kind of where our organizations or our, what's the right word for our council jurisdictions aligned. And so we were looking really into the spring to host maybe a West Side event, aligning with some of our FQHC partners, along with some of our councilwomen's areas. So we spent some time discussing that and getting ready to plan those events at our next meeting.
Thank you so much. We're going to open it up for comments now.
So one thing, and Councilwoman Santana could not be here today, but after talking to her a little bit more from committee meeting and then just recently, she wanted to earmark for the West September
Okay.
as the month. So the team, Laurel and Audrey and myself got together and kind of mapped out, if you will, the dates, and those are loose. Once the committee gets back together, they can solidify actual dates, but it pretty much is in alignment with the report outs today, minus that one change with Councilwoman Santana. So it gives you just a snapshot of how the year will go with podcasts, with the community meetings, and the domestic violence series, as well as a period product drive again. So a very full calendar. So, and I guess Audrey would ask who wants to lock in where. So with Councilwoman Santana taking the lead with a co-lead for the West, we're hoping she has a co-lead.
Yes, yeah, we'll confirm who's going to take the lead on the different community health events, and I will also circulate this to everybody after the meeting, so you'll have all these dates, as well as sending calendar invites for these meeting dates, so you can get them on there, on your calendars now, as I know things are already booking up for 2026. So that will be hopefully helpful, but locking in some more of those logistics and details for who will be the point people for these events will be incredibly helpful.
Other questions or comments, especially as we look at the 2026 initiatives? I want to thank the team at the county for helping us piece this together. It's a full calendar and ambitious, but I think that the dedication of the members on this committee, we're really ready to do the work and push it forward with our other community partners. So it looks very exciting. Perfect. Well, thank you so much from the Physical Health Committee for that important update. And once again, thank you for that calendar. And we'll continue to lock in dates and obviously share. We're grateful for David Merriman this afternoon to give us a SNAP update. We know that this has been an area that's been all over the place within the past 4 to 6 weeks, and so looking forward to these current updates today. Thank you, David.
Thank you very much, and thank you for keeping this on the agenda. I want to first acknowledge that as the federal government shutdown has ended, I am concerned that the public thinks the issues related to SNAP have also ended. That's not the case. In fact, it's the opposite. I think the threat of the changes to SNAP related to House Resolution 1, some people call it one big beautiful bill, are actually much more significant than the federal shutdown in the long term. And so what I do need to start by saying is that we still do not have rules written by the state of Ohio, and ultimately those rules will determine how we are going to implement the federal policy changes. Again, those policy changes are law. They were signed into law on January 4th of this year, and so there are some contradictions at times. And we just need to acknowledge that the information continues to unfold, and we are expecting to get a lot more information in the coming weeks and months. I can give one good example. By law, work requirements for SNAP have changed effective November 1st. However, the state is not expecting to implement those changes until February 1st of next year. And what that means is there were going to be in essence, several thousand county residents that will be expected to be doing some form of work activity to maintain their eligibility for SNAP. And there won't be any additional resources for those activities. We get millions of dollars to help TANF recipients who are on cash find activities to do. Those dollars won't come for SNAP. So residents will have to find their own activities and document them and report them to us. We think there will be between 20 and 30,000 residents affected by this change, and it will cause a lot of confusion. That's a one example of how this is going to roll out. Our goal is to engage the community. We've been doing that through the Hunger Response Team. And Kevin Gowan, the Director of Child and Family Services, has also been presenting in community forums and public meetings on a weekly basis since the launch of this change. We're going to be doing more of that. And so there will be additional convenings through the county executive, Chris Ronayne. He's going to be bringing together a work group. So we'll be focusing on SNAP in one hand and Medicaid in another. They're separate programs. That work will also kick off this month, and that will be more focused on hospitals and community institutions focused on the healthcare system. I think of immediate concern, and what we want to draw attention to is newcomers are going to be heavily impacted by these changes. Immigrants, refugees, folks whose status is legal in the United States but will not be allowed to access benefits. 4,200 newcomers were kicked off SNAP last month. And within the first 2 weeks, we recognized there were nearly 1,000 children that were inappropriately kicked off. We were able to restore those children and because even though a parent may not be eligible for SNAP, their children might be. That's going to continue. We actually have now some word that we expect more newcomers will be moved off the SNAP program beginning in February, and then Medicaid later in the year. We're also very concerned about individuals between the ages of 55 and 64. Many of them will have to do work activities to be able to receive SNAP moving forward. And they'll either have to be fully employed, be in a training program, or be volunteering somewhere and documenting their activities. I think there could be upwards of 17,000 55 to 64-year-olds that will be affected. They won't all have the same rules, and that's where waiting for the state's direction is critical for us. I think the last thing that I just want to say is we know that the community will see the impact of this. We'll see it at the hunger centers. We'll see it at the food banks and at hot meals programs. We know that happened when the government shutdown occurred. We saw a dramatic increase in calls to 211. Calls for food became the #1 reason people were reaching out to 211. We also saw all-time highs at the Hunger Network and the food bank. So we expect that to continue to be the case. We just have very, very serious concerns about how our community is going to be prepared to respond to this increased demand. I'd be happy to answer any questions or provide additional information if there's interest.
Third thing, you said volunteer work, or what was the third thing?
So it's either fully employed or some form of earned income, but again, that has to be at a level that doesn't prevent them from receiving SNAP. I think the second is being in training or education. So if they're a training education program, or if they're doing a volunteer unpaid work experience. And so that's that's a form of employment, but it has to be documented.
Do we have anything written that states that?
We do not. So right now, as it stands, our rules are tied to the historical able-bodied adult without dependence population, the ABODs. As it stands right now, we serve around 3,200 ABODs. Again, we think this number will grow between 20 and 30,000. And so the rules are written for that existing, as I say, 2,300 individuals. We haven't seen the rules for the 20 to 30,000 yet.
So I was just thinking, because we have a few computer centers out there that DSAS uses and things like that. So those individuals are training, are learning. Can we use things like that because they're learning, digital literacy, maybe sharing information with those kind of centers? So
Yeah,
most seniors only get like 20 or 30 bucks.
that's right.
But they need it with the prices that are today.
It's hard. It's a hard issue because the numbers, the hours that they have to document can vary based upon, as you pointed out, Councilwoman, the amount of resources, the amount of funding they're getting. But it also can be tied to the type of activity. Recently, I had a conversation with, I believe it was Michelle Rose from Greater Cleveland Works. Someone going to Greater Cleveland Works, or as it used to be called, Ohio Means Jobs, if they go and do their services, that will count for 7 of the 80 hours that they owe for the month. but the balance of the hours will have to be found through some other form of volunteer or paid work activity. So it varies based upon the activity, and that's why the rules are important, but also having staff to talk to residents to let them know. That staff issue is an important issue. We just have to acknowledge that we have the staff that we have, and we're not going to be adding a significant amount of staff to address the needs of residents. And so we'll be moving some of our caseloads around. It's a hard time for us as we've seen recent increased programs for childcare. There's been some changes in the PRC program, so we're going to have to ask for patience from the public as we juggle a number of significant additions where we're actually in a hiring freeze and we won't be adding staff. So this will be a period.
80 a month?
I'm sorry, 80 hours, generally speaking, but it can vary based upon the volume, the amount of funding an individual or family gets.
Can you use the mic just so everyone can hear you? Thank you.
You mentioned 80 hours per month. Is that able-bodied? And then you mentioned 55 to 64. What was the tier for that? Is that 80 hours per month as well?
The short answer is yes. There's a caveat there. So the able-bodied adult without dependent population historically was 18 to 49.
Okay.
Actually, last year they changed it to 18 to 55, and now they're changing it from 18 to 64. But there's a little bit of confusion in the federal laws. Frankly, it was rushed. So it actually is not entirely clear if all 60 to 64-year-olds will have to do activities or if just a portion of them will. But we can say that all 55 to 60-year-olds will have to do work activities. They are now ABODs. One other point that's confusing, families that have children 14 and older are also now being referred to as ABODs. And that's going to be thousands of families.
Yeah.
Right now, they're exempt. If you follow the definition, able-bodied adult without a dependent, that means someone who doesn't have a child. The federal government now considers a 14-year-old to be not a qualifying child for that household. So families that have a 15-year-old will have to be involved in a training activity, paid work or unpaid work to be able to receive their SNAP benefits.
Wow.
I want to, because I'm sitting in for County Executive Ronayne, I want to channel him. I want to thank David Merriman and Director Merriman and his staff. I've been here a long time. This has been the most outward-facing department, administration, Health and Human Services. David and I have worked in Human Services together for a very long time. Every week, his staff is on the ground out in the community. Many, many of our departments are trying to be out in the community for people to ask questions all across the county, east, west, south, everywhere. So kudos to his team. They're working long hours. They have a lot of phone calls. We're working with a lot of nonprofits. This team is really, really working hard. So more to come. They're asking every nonprofit to help. We know there's a Human Services Chamber. We've talked to them. Funders Collaborative, anybody who will listen. So as these things roll out in 2026, we're going to be asking everyone at this table and others, please get the word out. Please share the messages that are developed from his team. And we're in this together. And I just wanted to publicly give kudos to David and his team.
Thank you.
I want to piggyback. I want to piggyback on that. We, at a recent Shaker Heights City Council meeting, David's team and David came in, and our meetings are fairly early, so I appreciate that, came in and spoke to us. This was right in the midst of the federal government shutdown and the loss of SNAP benefits for residents in Cuyahoga County, but of course, we were specifically focused on the Shaker community. at the time. I do want to share that those conversations are extremely meaningful. In our last Shaker Heights meeting, we have approved a budget, and technically we're approving the budget next meeting, but we have added to the budget a community health worker to help Shaker Heights residents navigate these changes that are coming down the pike. And so, and it was because of the conversations that we had. And so much appreciation. And I think you can't increase your staff, and city budgets, everybody's budgets are tight, but looking for ways that other people can step in at that time. And so thank you so much for the education on that, and we're really excited to bring this opportunity to Shaker because of your team's work and work with us at the time. We are looking forward to the continued partnership too.
Well, thank you for the invitation. It's an honor to come and talk to our municipal partners. And I think it's a great strategy of adding a community health worker, simply because it's a proven model in which we go to the residents that need us most. And I think that's a great strategy. So thank you.
Absolutely. I think we have
Heather on the line would like to.
perfect. Thank you.
Yes, thank you very much, and kudos to you, David, and your team on a job well done. I wanted to know, for the individuals who have to do the volunteer work or the training, is there a certain time frame within the month that they need to get it done in order to receive benefits the following month?
So it's a very important question. I think what most folks would think is that benefits are generally, generated on the first of the month. That's actually not the case. Benefits are tiered in from the 2nd to the 20th. So that starts their month, so to speak. And so individuals have to achieve their hours in a varied month. It does get confusing. And so they have 30 days to get their benefits. That might change. That might change with the rules. It might get simplified, or it might not. That's one of the important issues that we need to communicate to the public, of what their obligation is to report their time. In the past, there's been a lot of issue with that, because individuals would think they've met their hours and they've been off by an hour or two. And when you're off by an hour or two, you're off. And if you get benefits when you're not supposed to, you can actually fail, and that could be an error, and that actually could count against an individual. So it can be very complex.
Thank you.
And it can go against our error rate.
Yeah, that's right. And in fact, we've begun to hear from the state. There was a possibility that the state would be stepping in to help with some resources to increase to fill the gap that a funding that's going to be generated by the House Resolution 1. It now looks like that won't be the case, which is a concern, because as we have less funding, there will be more errors. Because if you have less funding, you have less staff. The staff have to do more work. You potentially produce more errors.
Other questions, comments, or concerns? This is, once again, very timely, and I appreciate the conversation around this piece. Perfect. Thank you so much, David. And once again, you and your staff have just done a remarkable job. So please send them our well wishes and our thanks for all the work that they're putting in for our residents. It's much appreciated. We were scheduled to have an issues overview from the Center for Community Solutions, but due to some illness, we are unable to have that go forward today, but we're looking forward to having an update in February at our next meeting on some of the pressing and current issues. Any other business before the matter of the commission this afternoon?
To bring up, I had met with Clerk Byrd, Nayla Byrd, and Habila Grimes, and I know it was, as I sit on this committee as well as I sit on CASE committee. Don't ask me what the acronym stands for, but equity and inclusion. And so we were trying to decipher how those two can work together. I know it was brought up prior to me probably coming more frequently to this committee meeting. So is anybody aware of that conversation? And how do you feel that we should go about it? Invite them in to speak, or just looking for the committee members' ideas on that?
Thank you. We did, and I'm not gonna get the month right. I did have an opportunity to meet with leadership in that committee. It was like in the summer, was it? May? Okay, spring, summer, I don't know. In 2025, we had an opportunity to connect, and they're doing some wonderful things and getting I guess so maybe regrounded or refocused in the work. I think as we continue to draw out our calendar and hone in on the physical and mental side, I'm happy you brought this up today because we can continue to look for opportunities where we can partnership. It might be worth bringing them in just to give an overview for our committee who may not know the exact scope or breadth of their work or their purpose as well. But I just want to share we did have an initial conversation, and I think there will be some great opportunities for partnership as we move forward, opening it up for other discussion from committee members.
My recollection too is that they were doing some focus groups of their own in the community, and I know I just got an email from one of NAELA's staff around that they're going to be having a health equity focus group. So if anyone is interested in that, I can forward, or I can have her forward that the flyer to the group. But I think to the councilwoman's point, as they're getting to, kind of their focus areas where we can intersect potentially in the health space would be, so I think we all are open to that, right?
Well, I just wanted to share that we at Birthing Beautiful Communities have broken ground on our freestanding birth center. And very grateful to county and county leadership. And when I was just at I don't know what committee I was at. It wasn't one that you're on, but I was at a committee meeting. And they asked me, well, are you guys going to work with the Women's Health Commission once the building is done? And I said, well, I am a Women's Health Commissioner and happy to work with this committee as we think about all of the incredible opportunities to host events, to be with one another in that space, to have office space if we want other opportunities to really show support for women and families in this community. And as things are so crazy and it just feels like one thing after the next, after the next, after the next, thank you to this councilwoman right here, my councilwoman, who ensured that we were able to secure a grant and then really allowed us to leverage that grant to secure a loan from the county, and Sabrina Roberts and Laurel, who's been with us from day one. So thank you all so very much, and I think that it's just a testament to the power of women, the power of sisterhood, and the power of standing together for Black women and families across Northeast Ohio. And so I'm very proud of what we have been able to accomplish. We raised $13.1 million to get this facility built and done. And I hope that it is a great place where women and families feel safe, heard, and that it may offer some opportunities. And then, Mr. Merriman, I was thinking NLI might be a great opportunity because they have the navigators. If you guys are on a hiring freeze, their navigators, if we educate them, can be able to help the community understand what's going on, get those resources out, and then be able to help the people know what's actually going on. Because as I'm hearing it then, if it starts in February, then that means that, is it like in January they need to start?
So when someone's on SNAP, you get 3 free months before you have your hours have to count, but that's 3 months, I think, permanently. So I don't think you get to renew those annually. So that's one of the details that we're waiting to hear from the state is what will the actual date for those 3 free months be? Will it be November or will it start in February? And by the way, on the using navigators and community health workers, we're absolutely committed to that. We think that's a great strategy, and we feel like that is going to be one of the most important resources for our community as we respond. Totally agree with you.
Wonderful, and congratulations to Jasmine and her team at Birthing Beautiful Communities. That is, of course, going to be a wonderful addition to the Northeast Ohio community. So thank you and your team for all your hard work. Thank the people behind the scenes like Councilwoman Conwell and many others that we don't know, who we do know, et cetera, because it really does take a strong team to bring these to fruition. So wonderful. We're excited to hear that. Other comments or concerns or other new business to bring before the committee today? Wonderful. Thank you so much, everyone, for attending today and providing valuable updates. Our next Women's Health Commission meeting will be held February 19th at 9 a.m. As our calendar indicated, we will be having our either if you're on the mental health or the physical health subcommittees. So expect some dates for those in January for your calendar as well. But the next full meeting will be on February 19th at 9 a.m. Thank you, everyone, for sharing your time with us today. I'm very excited by all the great work this group has done in 2025. Kicking it off even this afternoon, sharing the Period Project and the donation drive and just everything and all your hard work throughout the year. I look forward to seeing and continuing the positive impact that we will have for women in Cuyahoga County in 2026. May I please have a motion to adjourn the meeting?
Before we do,
yes,
can I
I'm
just,
sorry.
one update? I did text Kevin Gowan, the Administrator of Job and Family Services, on Heather's question. It is actually a monthly calculation. So a person gets their SNAP November 1, would have until December 1 to get their hours. It's not rolling. So Kevin, I wanted to correct the record on that.
Wonderful. Thank you. Thank you very much.
I'll make a motion.
Thank you.
Second.
Wonderful. All in favor?
Aye.
Any opposed? Let the record show the motion has passed and this meeting was adjourned at 3:46 p.m. Thank you, everyone.
Thank you. Very well.
Thank you.